It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
All right, our next guest, Dr. Nicholas Jansson, primary care physician from CHI Franciscan. UV safety, ultraviolet rays. Shannon, summer's gone, but still got to be very aware of what's going on with regard to light.
Yeah, particularly in the Puget Sound. I mean, it may be cloudy, but you're still exposed to this UV light, which can cause skin damage, and we have to know how to protect ourselves with sunscreen, clothing protection, and just awareness, right?
All right, here's Dr. Jansson and Shannon O'Kelly.
Dr. Jansson, welcome back. You've come on Health Talk before. Today we're going to talk about kind of the sun, UV, and the damage that it can cause to skin and skin protection. We're going to run the whole gamut. But before we do, tell us again and tell our listeners about your practice. You're an internal medicine physician, so tell us about your practice.
Yeah, I'm an internal medicine physician. I've been in practice about 6 years. I practice in Burien with Franciscan Medical Group. Great clinic. We have 8 primary care doctors there, lots of on-site services. As an internist, I see anywhere from ages 18 to as old as you can imagine.
So is it fair to say as an internal medicine physician, you're part of that primary care focus, but your focus is really that 18-year-old to geriatric medicine?
That's right.
And you probably see a lot of different things in your practice from diagnostics, and you take the time to listen to patients, get a history of physical. Here we live in the Puget Sound, and the complaint in the Puget Sound is, it's cloudy, it's gray, it's gloomy, et cetera, et cetera. So we have to talk about skin cancer and the effects of the sun. There's a commercial playing on TV. It's interesting. I'm not sure if you've seen it, where it shows different people, and they put some kind of light on it and see the damage that the sun can cause to our skin, right? So let's talk about UV light and skin damage.
Yeah, it's amazing. It takes very little time for the sun to damage your skin. Most people think they have to be out there for more than an hour to be damaged, but it can be as little as 10 to 15 minutes, depending on the intensity of that day. There's 2 different types of UV rays that the sun emits, UVA and B. They both can cause skin cancer. UVB is more responsible for sunburns. And believe it or not, the type A is not blocked by normal just windows in our homes. So we want to counsel people all the time about using sunscreen. And the type of sunscreen that you want to protect yourself is the broad spectrum ones, the ones that protect you against A and B.
So there's 2 types of UV light. You're describing A and B. I'm sure they're determined by, we're getting into physics here a little bit, kind of like physics myself, but probably the wavelength and the type of penetration and the ability to move through obstacles, I would imagine.
That's right.
So the UVA is, which one's the good, bad, or are they both kind of the same?
Both bad, actually. They both do different things to the skin. Type A is more around, it can cause accelerated aging in somebody's skin, cause wrinkles. It also can cause cancer. B is more responsible for sunburns, as I mentioned, and also it has a higher risk of causing skin cancers in people.
Do sunscreens, when you read the label of a sunscreen product, are they going to say protects against A and B? Or
yes.
So you should look for that. Is there anything else we should look for in our sunscreen product from an application standpoint? How often? Is it waterproof? Is it good for kids, pediatrics, all that stuff? Let's talk about A to Z, because that's what you do as an internal medicine physician, A to Z.
Oh, it's a great question. So you want at least 30 SPF when you look for a sunscreen. 30 SPF will block out 97% of the sun's rays, both A and B. And a lot of people ask me, well, isn't a higher strength better? Won't it last longer? It actually won't.
Okay, that's good to know.
So when you buy a 60 SPF, you're probably only really blocking out maybe 2 to 3% additional beyond the 97%. There is no sunscreen that blocks out 100% of the rays. We also talk about the fact that the stronger ones really don't protect you for any longer. You really have to reapply sunscreen at least every 2 hours.
Every 2 hours. And what about in and out of the water and toweling off? If you wipe, you're wiping the sunscreen, you have to reapply, I imagine.
Absolutely. When you're in the water, even with a water-resistant sunscreen, which is what we should all be looking for, you probably need to reapply it more often, maybe every hour. Also, what's really important is the quantity. Most people only apply about 25 to 50% of what we should be applying. An easy way to remember is to think about just a standard shot glass, which is about 1 ounce to 1.5 ounces. If you fill that with sunscreen, that's what a normal adult and even a kid should apply to their body.
More with Dr. Nicholas Jansson coming up after this timeout on Como.
It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
We continue our conversation with Dr. Nicholas Jansson, primary care physician from CHI Franciscan, talking about UV safety with Shannon O'Kelly.
Well, Dr. Jansson, again, welcome, and thanks for coming on. I mean, you're doing a great job describing UVA and UVB. These are rays that can damage our skin in a couple different ways, and we're protecting it with sunscreen application, type of sunscreen, et cetera, et cetera. Let's talk about the Northwest. You know, people perceive or assume it's cloudy. You know, I don't have to put anything on, but a cloudy day, you can still get burned.
Absolutely. And not only cloudy days, but snow as well.
Oh, really? Yeah, right.
You know, and the great blessing is we live in a part of the world where we have access to a lot of great skiing and snow, and people should remember that when it's a sunny day, especially a sunny day on the snow, that the snow and also clouds, as you mentioned, will reflect the sun's rays. And so sunscreen, the same sunscreen rules apply to sunny days as they do on those days as well.
What should I look for? I guess that's the question. If I have some kind of skin change or damage to my skin, how do I know I need to get checked out? Because again, if it is skin cancer, it's early intervention.
That's a great question. People, probably one of the most common things that primary care physicians like myself see is somebody has a concern about their skin, and there is no wrong concern. Even the smallest dot in your skin, if it's new, if it's changed in any way, like become raised rather than flat, if it's turned darker or bigger, if it itches, bleeds, or if it's one of those sores that it might heal, but then it keeps coming back over and over again. Those are the types of things that we want for people to bring to us. Many times what we'll end up doing is send them to dermatologists who will look at them up close with a special light called a dermatoscope. It looks very similar to what primary care docs like myself use to look in the mouth or the ears. Mm-hmm. And they look up very close, and they're able to see features about it that might make them more or less concerned, but they can properly guide you as to how to approach it.
Is it fair to say that you don't always, you need to check your entire body? I guess the question is, I've heard of people getting skin cancer like in an area where it's never exposed to the sun. You know, they can show up in other places. How's that happen if those areas have never been exposed to sun? Is that a metastasis type situation?
It can be, but there's a lot of folks who just have a genetic predisposition to having skin cancers, and you're absolutely right. Those are going to happen in places that aren't typically exposed to the sunlight. So what's really important, it really, I think, highlights the importance of those yearly physicals where your primary care doctor can really do a good full skin exam, especially in areas, more sensitive areas where the sun is not hitting, because cancers can grow there. And
cancer, if it's caught early, like we said, I mean, if you get in, don't wait and think, because I mean, as a patient myself and as a healthcare practitioner, people always say, I thought it was going to go away. I just thought it was going to go away. I thought it was going to get better, and then it doesn't get better. And then, so get in and see and have that looked at. Whether you, like you said, have a question or concern, it's better to be safe than what they say sorry, right?
Absolutely. Most skin cancers, when caught early, are very, very treatable.
And how do they treat that? I know we're kind of running out of time, but is that just, a lot of times they'll just take the cancer out? I mean, most likely debride it, so to speak?
That's right.
And then is there any kind of radiation that's needed, or?
For the more severe forms, but in most cases, the dermatologist can just remove it locally with a very small incision, and usually that's curative in most cases.
Great stuff. Listeners, get that sunscreen on, even if it's cloudy, wet, and you're skiing or at the beach. Application is important. Product is important. Protect yourself. Thank you so much, Dr. Jansson.
My pleasure.
Great stuff.
That was Dr. Nicholas Jansson. If you'd like to get more information, go to chifranciscan.org. UV safety, something that has to be top of mind year-round. Like you mentioned here with the cloud cover in Seattle, doesn't mean we can't be damaged by the UV rays.
That's right, Tom. I mean, you and I grew up in Eastern Washington in the days where sunscreen didn't exist, right? And now we know better. So if we have it, use it, and use it often. Get it on.
All right. We'll be back with our final segment after this time out right here on Como.